So today we're lucky enough to have Kristen Massimino join us, and she is the chair of the Community Practice Committee of the SSO. Welcome.
Thank you, Dr. DeMatteo. I'm very happy to be here.
So can you give us a little background on the Community Practice Committee? Tell us, the size of it, sort of how long it's been around, things like that.
Sure, I'd love to. The Community Practice Surgeons Committee is a relatively small committee. I think we're about a dozen or so members, and we represent community practice surgeons from all over the country in a variety of practice types. Many of the members have really diverse practices in general surgical oncology. Some of us are sort of single site disease surgeons like myself. And we started as a subcommittee or a subset of the membership committee, where this group kind of was housed for years. And then in 2023, we became a full committee of the SSO when I think the SSO had an increased commitment to the community practice members of the SSO. And so since then, really our goal is to represent community practice surgeons and their interests in content and in as a liaison to the leadership of the SSO and SSO staff.
Mm-hmm. Well, the $1 million question, and one that gets brought up on a regular basis within the SSO, is how can we increase the outreach to our community practice surgeons? I feel like the SSO has so much to offer them, and they have a lot to offer us. So how are we going to build this better?
To me, in order of importance, that's content. And the SSO already does an amazing job of providing content that is applicable to community practice surgeons. The second most important thing, I think, is opportunities for connection. Those of us who trained at a larger fellowship or work in academics or practice with other surgical oncologists are lucky to have kind of built-in mentorship. And that's something we hear from our community practice surgeons that some of them struggle with, is finding good membership in the community, especially if they didn't do a fellowship or did a very small fellowship. So those are things we think about on the committee and are hoping to maybe bring forth some ideas to the SSO. And then I think lastly, opportunities within the SSO for individual surgeon engagement. And this committee is a great opportunity for community practice surgeons to get involved, at least as a stepping stone. And having community practice surgeons be a part of the disease site work groups, for example, and the program committee, for example, would be really great ways to get them involved, allow their ideas to be heard more prominently and incorporated into our content and events.
Mm-hmm. Well, yeah, that's a great suggestion, and we probably should do that almost right away, because I think that would give a different perspective than maybe what some of the content that we have already is. So we're going to work on that one as soon as we get done with this call. So lastly, are there any other plans that the committee has for the next 6 or 12 months?
We do. So we have several podcasts. 2 have already been recorded and are waiting to be released. I would like us to work on, it's come up a little bit, is some kind of more formal mentorship program within the SSO for community practice surgeons.
There's plenty to do. And I would say among all the committees, yours has to be one of the ones that has the greatest potential for future growth. So thank you for everything that you do for the SSO. And it's been nice talking with you today.
Yeah, thank you for having me. It's been my pleasure.